So this is our Gait lab, our patient area. We actually have two. One side is geared towards prosthetics and the other side is geared towards orthotics. And if you don't know the difference, I'll explain very quickly. Prosthetics is when we're replacing a missing part of someone's body. Where an orthosis or some type of brace is used either to support a weakened member, limit some range of motion, or something like that. This is a pretty typical kind of a gait area. We have parallel bars, and then as we go back this way, you'll see we have a set of ramps. This is so that we can demonstrate people walking up and down, see how they do with their prosthesis. There are a lot of ground reaction forces that affect how the prosthesis presses on the residual limb. And so when we watch people walk up and down here, we can train them. And frankly, we do a lot of the initial training. And it's very, very important that the therapist who is going to be treating this patient, number one, have a super clear understanding of how that particular prosthesis works, what it's expected to do, how it does it, and then what it can't do. So it's very, very important that the physical therapist and the occupational therapist work closely with the prosthetist who's made that device so they can be aware of properly how to don it, how to doff it, and what it can do and what it can't do. You know, how you walk down a set of ramps with a prosthesis can be very different from how you walk down with a normal leg. Same thing with stairs. So we've set this place up to be pretty utilitarian. As you can see, we've got some interesting old prostheses on the walls, just for people to see and ask questions and talk about. And then we have these private exam rooms where the patients are actually treated with their prosthesis and putting them on, taking them off, measuring, casting, and that kind of stuff. So from here, we're going to be heading out into the laboratory part, and I'm going to show you exactly how these things are made. And I think this is important because as the therapist sees how these things are done, you get a sense of what's possible and what isn't possible with a prosthesis. So here we go into the labs.